In this case, there is a 69-year-old man who is coming in and he has had a cabbage as well as an aortic valve replacement. And so the question is, what is going to happen to him next? So he has a medical history of aortic stenosis, coronary artery disease, and hypertension. And then he is sent to the step down unit. And then at that point, he has weakness, chest tightness, and shortness of breath. It's noted that vital signs are going as low as 70 over 30, pulse is 148, and then respirations are 26. He's also noted to have basilar crackles on examination. So it looks like he's not doing too well. So initially, you want to think, what do you do in a person who has a pulse? But then they have and it's an adult with tachycardia. So this is the ACLS guidelines. And then, so you start off looking at the appropriateness of the clinical condition. And then you want to look at the heart rate, which is typically greater than 150 if it's a tachyarrhythmia. You want to treat and identify an underlying cause. And in the meantime, you want to maintain a patent airway and assist breathing if needed. You want to be able to give oxygen, and you also want to monitor to identify the rhythm. You want to monitor blood pressure as well as oximetry. If it's persistent tachyarrhythmia, as in this person's case with hypotension, altered mental status, signs of shock, ischemic chest discomfort, or acute heart failure, then you want to switch to synchronized cardioversion. And of course, you want to give sedation. And then if it's a regular narrow complex, you want to consider giving adenosine. And then if the answer is no, if the person is stable, QRS duration is greater than 0.12 or 0.12 seconds, then you want to establish IV access, consider adenosine. If the rhythm is regular and monomorphic, consider an antiarrhythmic infusion, and then obviously consider talking to cardiology. If the answer is no to this, then what you can do is less invasive stuff. So you want to get a 12 lead EKG, vagal maneuvers, adenosine if it's a regular rhythm. You want to consider giving a beta blocker, a calcium channel blocker, and then consider calling cardiology as well. And one thing I want to go over in this video is the difference between defibrillation versus cardioversion. Something I always get confused about. So defibrillation, it delivers the shock at a random point in time, and then cardioversion, it delivers it in a synchronized manner. So in this case, the patient would be receiving cardioversion versus defibrillation.